I'd like to acknowledge the traditional lands of the Ngunnawal and Ngambri peoples, Madam Deputy President, and acknowledge that this is an incredibly historic day for the Australian Parliament. I have with me, at the pleasure of the President and the Deputy President, a coolerman, which in First Nations people's way is important for our babies. It's also important for other parts of First Nations culture, and that is for food gathering, for water, for life-giving. And I have this symbol of the coolerman with me today to acknowledge especially the parents and the families who are here in the Senate to witness this historic occasion, but also to say thank you to each and every one of you and to all those who are listening and watching across Australia who couldn't be here but are here in spirit, just like your children are with us, your babies. In my language we call it liarbiri or barara. And the spirit of your barara is here with us in the Senate, in the Australian Parliament, and it is so significant what you have done in sharing your personal stories and journey with us, the committee, and with Australia. We are going to change and make a difference for our bararas across this country, and I thank you from my heart to yours for being so open, and for your babies who are with us too. Madam Deputy President, I also want to thank and acknowledge the members of this committee. Deputy Chair Senator Jim Molan, Senator Janet Rice, Senator Katrina Bilyk, and Senator Lucy Gachui, and most especially Senator Bilyk Keneally, whose advocacy and passionate perseverance in guiding and directing our Parliament to this point has been so important. We decided from the outcome that this had to be a sacred journey, carrying our babies, remembering and honouring the spirits who are past, but also the spirits of our babies who are yet to come. And there had to be a sacredness to this journey, and I thank each and every Senate committee member for holding that, for holding those babies, and holding the sacredness of this important report to the Australian Parliament. Stillbirth affects over 2,000 Australian families each year, and for women from Aboriginal and Torres Strait Islander backgrounds, the rate is double that of other Australian women. And despite advances in medical care and treatment, the rate of stillbirth in Australia has not declined over the past 20 years, and too many of those stillbirths are deemed to be unexplained. And this is so not acceptable. There is a clear need to improve the cultural protocols around dealing with families who have suffered stillbirth. The committee heard very disturbing evidence about 6 stillborn babies of Indigenous descent who had remained in the morgue at the Katherine Hospital for a number of years, 6 years for some. Evidence was presented for the difficulty of contacting families who lived in very remote communities, the lack of resources available for locating and working with bereaved families. I noted that there may also be financial issues. Another key issue, Madam Deputy President, raised by witnesses and submitters in relation to employment matters concerned leave entitlements for parents who experienced a stillbirth. We heard evidence from women who had been made redundant while recovering from stillbirth. And a key recommendation of this committee was that Section 77A of the Fair Work Act 2009 and provisions relating to stillbirth in the National Employment Standards are reviewed and amended to ensure that provisions for stillbirth and miscarriage are clear and consistent across all employers, and legislative entitlements to paid parental leave All of that unambiguous in recognising and providing support for employees who've experienced stillbirth.
I welcome this report, and I was very keen to participate in this committee because whatever policy changes arise from it, the inquiry has brought the topic of stillbirth out into the open. On the 2nd of July 1983, I gave birth to a still baby. His name was Timothy Robert Bilyk, and he's buried in Gungahlin Cemetery. And I tell you this, I make a point of that because that was 35 years ago. I doubt there's been a day in my husband's or my life that we have not thought about him. I doubt that people realise that in that 35 years, the statistics have not changed in that 35 years. And to me, the importance of this inquiry was to ensure that we managed to change those statistics. The committee's report refers to a culture of silence around stillbirth, and the first steps in addressing this tragedy is breaking that silence and tackling some of the myths and misconceptions. For example, stillbirth is more common than you may think, and we've heard around 2,000 stillbirths occur in Australia every year, 6 a day. 6 a day.
252 days ago, the Senate voted to establish the Select Committee to inquire into stillbirth research and education. In that short period of time, in just the 8 months that we've passed since the Senate inquiry began, 1,512 babies have been stillborn in Australia. The report we table here today is a first. It is the first national investigation and report on the impact of stillbirth on Australian families and the Australian economy, and the first national set of recommendations that what we as a nation can and should do to save babies' lives. 6 babies a day are stillborn in Australia, and the key finding from this report is that we can do better. Our rate of stillbirth is significantly higher than similar nations such as New Zealand, the UK, the Netherlands and Scandinavian countries. And while the rate of stillbirth has declined over the past 15 years in countries with similar levels of economic performance and educational achievement as Australia, the rate in Australia has stayed the same. I will confess, there were times I grew incredibly angry as we undertook this work. The anger resulted from frustration, because there are some clear, simple, and relatively inexpensive steps that we can take in order to prevent and reduce stillbirth in Australia, and we have simply not done so. Now, I didn't grow angry in any partisan way. This has not been a partisan inquiry. The Senate voted across all parties to support the Senate stillbirth inquiry, and I'm pleased to report this is a report with multi-party support. I pay tribute to my colleagues, Committee Chair McCarthy, who led us with wisdom and grace, to Deputy Chair Jim Mullen, who was a pleasure to work with, and strangely enough, at times his military experience actually gave us great insight. Senators Janet Rice, Lucy Gachui and Katrina Bilyk brought great patience, understanding and compassion and intellectual rigor to this work. I also note we were incredibly well supported by Sophie Dunstone and the committee secretariat, and I thank them for their thoughtful efforts. The anger I felt wasn't directed at anything other than just grief, that babies have died in this country when we could have saved them. And why didn't we? Well, because for so long we have been understandably hesitant to speak about stillbirth. It's a particular sadness, a singular grief, one so hard to fathom that I can understand that collectively, as a country, we have considered stillbirth too sad to talk about as a public health problem. This inquiry marks a significant moment when we as a country can no longer stay silent about stillbirth. It also marks a point in which we can no longer say that we don't know what we can do to help reduce stillbirth and save babies' lives.